Back in the 1960s through the late 1990s, hormones were seen almost like magic. For women entering menopause or even approaching it, hormone replacement therapy wasn't just a treatment, it was a revolution. Doctors and scientists hailed it as the ultimate breakthrough, and for many women, it truly felt like that. Suddenly, there was a way to relieve hot flashes, night sweats, mood swings, and vaginal dryness, all the symptoms that had been brushed off for generations as just part of getting older. Hormones promised something radically different: control. At the time, the science and the messaging aligned around the same idea, that estrogen was the key to vitality, youth, and emotional balance. Advertisements, health magazines, and even medical conferences promoted the message that estrogen wasn't simply about managing symptoms, it was about prevention. It was said to protect the heart, keep the bones strong, and even maintain mental sharpness. Women were told that taking hormones could keep them feminine, attractive, and energized long into their later years. That message resonated deeply, especially in an era when women were finally starting to have more control over their reproductive choices, their careers, and their independence. By the late 1990s, nearly 40% of women in midlife were taking some form of hormone therapy. It became part of regular health care, almost as routine as taking a multivitamin. Doctors prescribed it liberally, often with the best intentions, believing it could improve quality of life and even extend longevity. For women, it represented a form of empowerment, a way to fight back against aging and to reclaim their comfort and confidence in their own bodies. It was more than a medical treatment. It was a cultural statement that women deserved to feel good, to age gracefully, and to stay in control of their health. But it's also important to remember that the enthusiasm of that era came from a genuine place of hope. We were finally seeing science pay attention to women's health in a way it hadn't before. For centuries, female biology had been under-researched and oversimplified. Now there was momentum, funding, and public interest in understanding the hormonal changes women experience. And in that excitement, hormone therapy became the star, an elegant solution to the complex challenges of menopause and aging. Yet even as hormone therapy grew in popularity, not everyone benefited equally. Many women found dramatic relief, better sleep, better moods, even improved intimacy. Others experienced side effects that were minimized or misunderstood. Still, because the benefits seemed so powerful and the alternatives so limited, most women accepted hormones as a natural, even essential, part of aging well. Doctors reassured their patients that it was safe, and women trusted that message. That trust created a powerful bond between medicine and the female experience. It wasn't just about estrogen or progesterone. It was about believing that medical science had finally unlocked the secret to feeling whole again. The movement toward hormone therapy reflected a larger societal shift. Women no longer had to suffer quietly through menopause. They could take action, they could feel young again, and for a while, it truly seemed like that promise was being fulfilled. But as with many revolutions in medicine, what starts as a breakthrough often leads to deeper questions. The widespread use of hormones opened the door to decades of research and eventually scrutiny. Scientists began asking whether the promise of prevention matched the long-term outcomes. Those early years of optimism set the stage for one of the most dramatic reversals in women's health history, a shift that would later redefine how we think about risk, trust, and informed choice. And that's where everything began to change. In the early 2000s, everything women thought they knew about hormone therapy was suddenly turned upside down. For decades, it had been considered the gold standard, the smart, modern choice for managing menopause and protecting long-term health. Then came the study that shook the medical world, the Women's Health Initiative. It was massive, over 160 0 women enrolled with one big question at its core. Could hormones actually prevent heart disease, osteoporosis, and other age-related problems in postmenopausal women? What researchers found was not what anyone expected. Instead of confirming that hormone therapy protected the heart, the study revealed the opposite. Women taking a combination of estrogen and progestin had a higher risk of breast cancer, blood clots, stroke, and heart disease. The media took that data and ran with it, splashing alarming headlines across every major outlet. Overnight, hormone therapy went from being a symbol of empowerment to a source of fear. Millions of women stopped their prescriptions, and within months, use of hormone replacement therapy dropped by nearly half. Doctors were just as stunned as their patients. For years, they had confidently prescribed hormones, believing they were doing what was best for women's health. The study's findings made them question everything. Was the treatment actually helping or silently harming? That uncertainty created a ripple effect through medicine, one that's still felt today. The trust that had built up over decades between women and their doctors was suddenly shaken. But it's important to understand why the reaction was so strong. Hormones weren't just about treating symptoms, they had been part of women's identity, part of the promise of modern medicine. When that promise was challenged, it wasn't only the science that was questioned, but the faith women had in their healthcare system. Many felt betrayed. They had done exactly what they were told, taken exactly what was prescribed, and suddenly found themselves wondering if it had all been a mistake. Over time, researchers revisited the data and realized the picture was more nuanced. The risks found in the study were mainly associated with certain age groups, particularly women who started hormone therapy many years after menopause. For younger women, especially those within 10 years of their final period, the risks were much smaller and in some cases the benefits outweighed them. But by the time those clarifications came, the damage had already been done. The fear had taken hold, and hormone therapy's reputation never fully recovered. The early 2000s marked a turning point in how women approached their health. Instead of simply trusting a single treatment or medical narrative, they began to demand more transparency and individualized care. The idea of a one-size-fits-all solution was over. Doctors, too, started to shift their approach, focusing more on shared decision, taking into account a woman's personal risk factors, her family history, her symptoms, and her preferences. This change didn't just alter how menopause was treated, it reshaped the entire conversation around women's health. It reminded us that medicine isn't static. What we believe to be absolutely true one decade can change completely the next as new evidence emerges. It taught both doctors and patients that the key to better health isn't blind trust or fear, but balance, questioning, learning, and evolving together. The story of hormone therapy's rise and fall isn't just about estrogen or risk. It's about trust, empowerment, and the courage to re-examine what we think we know. And as the use of hormones declined, another class of medications began to rise, ones that would quietly, but profoundly, influence women's sexual health in a whole new way. As hormone use began to decline, another medical trend quietly surged to the forefront: antidepressant use. What started as a shift away from hormone therapy slowly gave rise to an entirely new kind of treatment culture. Women who had once turned to estrogen for balance and mood support were now being prescribed selective serotonin, reuptake inhibitors or SSRIs, to manage depression, anxiety, and the emotional fluctuations often tied to midlife and menopause. At first, this seemed like progress. Antidepressants were seen as safer, modern, and non-hormonal. Doctors felt confident offering them as an alternative to hormone therapy, especially for women who struggled with mood changes or sleep issues during menopause. And to be fair, these medications helped many women stabilizing emotions, reducing irritability, and easing the stress that often accompanies hormonal transitions. But as more women began taking antidepressants, another pattern began to emerge, one that no one was talking about openly: low libido. For years, sexual health had been treated as secondary, almost an afterthought. The assumption was that as women aged, desire simply faded. But what many didn't realize was that medications like Rise could directly suppress libido, delay orgasm, or even eliminate sexual desire altogether. Women who had once taken hormones to restore their vitality were now finding themselves disconnected from that very sense of self. Only this time, the culprit wasn't menopause, but the medication meant to help them cope with it, and then came the oral contraceptives, adding yet another layer of complexity. For younger women and those transitioning out of reproductive years, birth control pills were often prescribed not just for contraception, but for regulating cycles, managing acne, and balancing mood swings. Yet, oral contraceptives also alter natural hormone levels, particularly testosterone, which plays a major role in sexual desire. Combined with the widespread use of antidepressants, these overlapping treatments created what some experts now call a perfect storm for low libido. Imagine being a woman in your 30s, 40s, or 50s, managing work, family, relationships, and realizing that something fundamental has changed. You're doing everything right, taking your medications, staying healthy, following medical advice, and yet your desire, your energy, your connection to intimacy feels muted. For many, this disconnect leads to frustration, confusion, and even shame. Because sexual desire isn't just about sex. It's about confidence, identity, and emotional well-being. Unfortunately, the conversation around this issue has long been whispered, if acknowledged at all. Women often don't feel comfortable bringing it up, and many doctors don't always ask. The focus tends to stay on mental health, not sexual health, when in reality they're deeply intertwined. Hormones, neurotransmitters, and mood all operate in the same delicate system. When one piece is off balance, everything else feels it. What's most surprising is how normalized this silence has become. Millions of women take antidepressants or oral contraceptives without ever being told that a drop in libido might be a side effect. For others, the changes are so gradual that they don't even realize what's happening until years later. By then, it's not just a physical issue. It's emotional, relational, and deeply personal. But this isn't a story of loss. It's a call for awareness. Understanding how these medications interact with our bodies isn't about blame. It's about empowerment. It's about recognizing that women's sexual health is a vital part of overall well-being and deserves to be discussed with the same openness and seriousness as any other medical concern. As we began to understand these complex connections between hormones, mood, and desire, a new approach started to take shape, one that looked beyond blanket prescriptions and focused on the whole person, not just the symptoms. That's where the conversation started to change again, and a new era in women's health quietly began to emerge. Today, we're living in a new era of women's health, one defined not by fear or blind trust, but by information, choice, and balance. The pendulum has finally started to swing toward a more personalized approach, where no single treatment is seen as the answer for everyone. Instead of assuming all women need the same hormones or the same antidepressants, healthcare is now shifting toward understanding why symptoms happen, what's driving them, and what combination of treatments truly supports each woman's individual biology. It's a big change from how things used to be. Decades ago, women were often told what was best for them. Today, more women are asking questions, requesting lab testing, reading research, and seeking second opinions. They're learning that hormonal balance isn't just about estrogen or progesterone. It's about the entire interconnected system. The the brain, the thyroid, the adrenal glands, and even gut health. Each plays a part in mood, energy, and sexual function. When one piece falls out of rhythm, the rest follows. Doctors, too, are learning from the lessons of the past. The one-size-fits-all hormone therapy era taught us that enthusiasm without individualized data can lead to unintended harm. Now healthcare professionals are focusing on precision medicine, customizing treatments to match a woman's age, genetics, medical history, and lifestyle. For some, that might mean a carefully tailored hormone plan. For others, it could be non-hormonal options, therapy for mood management, nutritional changes, or even addressing sleep and stress before prescribing medication. This holistic approach is transforming how we talk about libido, mood, and menopause. It's no longer about fixing a single symptom, it's about understanding the root cause. If a woman experiences low desire, instead of automatically blaming hormones or antidepressants, we now explore all the potential contributors. Is it stress, sleep deprivation, relationship strain, a medication side effect, a hormonal shift, or perhaps all of the above? When women are given the full picture, they can finally make informed decisions that align with both their physical and emotional needs. Another powerful shift has been the rise of open conversation. Social media, podcasts, and platforms led by women's health experts have broken the silence that surrounded libido, menopause, and hormonal changes for decades. Women are finally talking to each other about what's happening in their bodies without shame, without stigma. They're realizing that low libido, fatigue, or mood swings aren't just personal flaws. They're signals from the body asking for attention, understanding, and care. The goal now isn't to chase youth or perfection, it's to achieve alignment, to feel well in your body at every age, to understand that hormonal health, sexual health, and mental health are all deeply connected, and that taking care of one supports the others. It's about balance, not just biology, and perhaps the most important change of all is the shift in mindset. Women no longer have to choose between suffering silently or surrendering control. The new approach honors both science and self-awareness. It says, you know your body better than anyone else and your experience matters. That's the heart of this new era: empowered women, informed choices, and a healthcare system that listens, not lectures. Because when women have both knowledge and options, they don't just treat symptoms, they transform their health, their confidence, and their connection to themselves. And that's where true healing begins.